A report in today's Gazette from Gazette health reporter Aaron Durfel shows that a record number of heart patients have died while waiting for their surgery. But the worst part of that, bad enough as it is that it's a record number, and it's 3 times higher than the most we've ever seen up until now, part of the reason being attributed to this is even worse, and that's apparently over a dispute over jurisdiction and resources between the health ministry and Santé Quebec. So, as I said, I can't imagine that in a situation like this, you'd have 2 various levels, both responsible for health, going after each other over such petty things, but it appears that's exactly what's happening. Dr. Louis Perrault is president of the Quebec Association of Heart Surgeons, and he is on the line. Dr. Perrault, thank you for your time. Am I understating or overstating what's going on right here? As far as you're concerned, when you hear that people are dying on waiting lists for heart surgery, clearly there's something wrong, and I know the government's been warned about this, so what's going on?
Well, the first time we came out with this was in 2019, and back then there was about 12 patients in the whole province during 1 year. And we said that we told the government that there needed to be an increase in all personnel that takes care of heart surgery patients, more ORs, et cetera, more operating rooms. Then came the pandemic. Obviously, a lot of patients had didn't show up at the hospital, but the waiting list has been creeping slowly from 2019 to now. Now it's record high. There's about 2/3 of patients that are outside of medically acceptable delays. And, before we had anecdotally 1 or 2 patients once in a while, that didn't make it to surgery, but now it's dozens of patients. And it's extremely worrisome because nothing's been done. So it's just going to get worse before it gets better. So
you talk about it going back to 2019, but I mean, from what I understand, at least in the Gazette article, the idea here is the government, as I said, has known about this, knows about how things are going right now, yet despite knowing about this, there was no news whatsoever from the health ministry or Santé Quebec?
Well, what happened is that, last year we had a game plan with different hospitals proposing solutions and obviously needing a little bit of investment to operate more patients. And this never came true. And we had a plan in June 2024, but then we went into the summer, and then by the fall, everything was pushed towards Santé Quebec, which was not functional until December, and it's still not functional. And that's it comes across as a dispute, but right now there is no clear cohesion between the ministry and Santé Quebec. So it took us 4 months to get somebody in a meeting to talk about these things, and we have no solutions in sight.
4 months to get a meeting over patients dying, and still nothing resolved in terms of any kind of a definitive answer. I read in this piece as well, the suggestion is they're simply overwhelmed and don't know what to do. In other words, we know when Santé Quebec started, they were handed, by the ministry, a task of cutting over $1 billion from their budget. It would seem to me fairly clear now that this is having an effect.
Oh, definitely. Not just in cardiac surgery, but also in cardiology at large, electrophysiology, pacemakers, and ablations for atrial fibrillation. Mm-hmm. These procedures have a long waiting list also, and we don't have access to the latest technology that would be more safer and more efficient. So, definitely, we had a meeting, but nothing's come out of it. There's no solution. There's no changes. We have a lack of personnel, particularly perfusionists, and we need to improve their working conditions so that they don't leave for the States or other provinces because they're the lowest paid in Canada. Perfusionists are not doctors. This is not a pitch for doctors. We need to support personnel, and we've been waiting 6 months to get a positive answer from both the ministry and Santé Quebec.
Yeah, I'm sitting here shaking my head as you say that because, again, we've highlighted problems in the healthcare network before, but to think about something as serious as this where people are dying while waiting, it's one thing not to get a knee replacement, quickly enough. It's another to need a heart operation and not be able to get it and then die while waiting. Yet you're making it seem like the government is not taking this very seriously at all, or Santé Quebec is, and I'm not sure who it is.
Well, perhaps they say they're taking it seriously, but there's been no gestures, no, again, no package of solutions, no investments, and no increase in the number of patients operated. So this is why we see those results.
So what are we looking at here down the road? I mean, are things going to get better? Are you hopeful they will? Does someone have to step up here? Are more people going to continue to die?
Well, that's why we're coming out, because our discussions are fruitless for now. There hasn't been any action plan put together. So I think that the last time we came out, we had a meeting the next week with a few, with the Ministry of Health and a few sous-ministres, and we'll take it from there. But I mean, we looked at 1 year last year. We had 79 patients. Now we've updated our census, and the last 6 months it's 37 patients. So it keeps on going. So there's got to be increase in personnel, increase investments, and increase in the number of cardiac surgery patients scheduled.
So you just talked about perfusionists, and I see the reaction here from someone at the health minister who's made aware of this. And I don't know if you saw this in the story, disputing the fact that there might be a shortage. She says, according to the data, the unavailability of a perfusionist is the reason given in less than 1% of surgical cancellations.
Well, that's sort of masking the figures, because if there's no perfusionist, you don't schedule a case. You see what I mean? You don't schedule it. So, and we've known in the last several years that the number of heart surgeries planned is insufficient. It's lower than it has been, and it should be around 8,000 or 9,000, and it's closer to 6,800. So because the decrease in cardiac surgery volume, you got longer waiting lists, and then you have those tragic results.
And I'm guessing as the population ages, this is going to get worse before it gets better.
You bet. I mean, there's more and more people, that should have access to cardiac surgery. It's a shame. We have the operating rooms, we have the surgeons. Most of the time we have the rest of the personnel. We don't have the perfusionists. So we have everything, but yet the patient doesn't get to his treatment. And as you said before, rightly, I mean, this is lethal. If you're not getting your operation, sudden death awaits you, perhaps.
We have to leave it at that. I kind of don't even know what to ask next, whether you're hopeful or not hopeful. You'd have to think the government, now that the story is becoming public, somebody will step up and say, okay, this fell in between the cracks, if you can believe it, and things will change. Are you hopeful that might happen?
Yes, and we'll keep advocating for our patients, but we know the solutions. They just need to work with us, and we'll improve care.
All right. Dr. Perrault, I thank you for the time. I appreciate it.
Thank you, sir.
Take care. Dr. Louis Perrault, president of the Quebec Association of Heart Surgeons. People dying on waiting. This is in Quebec. Dying on waiting lists for heart surgery because two sides in the health ministry and on Santé Quebec can't get their act together. It's unbelievable.